CASEP was formed so that when the powers that be in a certain municipality or jurisdiction decided to go after the local program, then we responded as a state network. So that the powers that be got the message that you can't pick us off one by one, that if you go after one, this statewide network, which had the backing, of course, of NASON and DPA, you know, and all the harm reduction heavy hitters at the time as well. And so it wasn't, you weren't going to just go after this small program because we were all small at that time. You were going to go after this powerful network that was backed by other powerful networks. That's always been a favorite weapon of the drug warriors, to divide and conquer. And we realized early on that we had to counter that if any of us were going to survive. Because every other place in the world that tried to do a syringe services network, they imploded. So CASEP is the longest, oldest syringe services network in the world. And we're kind of proud of that.
My hope is that we could just get it into every little freaking nook and cranny of the mental health system, of the substance use system, of the, you know, all the systems and all the institutions.
I hope that harm reduction as a whole in more and more places gets to come above ground. I think this work exists in a lot more communities than are funded, recognized, supported, or able to tell someone this is what they're doing. And so I just hope to see like more of those kind of mushrooms pop up from this network, that we all support each other in this work, and that more folks can kind of come out, both who are doing the work and who are using drugs.
We're trying to get low barrier testing for hepatitis. I was cured of hepatitis C 5 years ago. I also live with HIV. So all the testing is important out on the street, reaching out to marginalized populations. You know, I'm singing to the choir, but housing. You know how many times I lost my meds or stuff in my backpack, or they got soaking wet or whatever, or lose your phone or you sell it. Because if you have a place you can go at night and maybe look at your phone, keep your appointments, a nest is so important.
Well, one, we know we're in one of the most progressive, wealthiest states or areas in the entire world, right? And so, but if we look outside, it doesn't always reflect that. Like, I want us to do more whole person health. Like, we need to focus on people's housing, mental health. Oh my gosh, mental health is such a major thing. There's not enough mental health providers out here to help our participants, because we need to get to the root of why people are using drugs, and then like the trauma that they're dealing with. But people are just trying to feel better, so they're using drugs, they're doing what makes them feel the best at that moment. And our job is just to say, okay, so how are you staying healthy doing all that? In a dreamland of rainbows and unicorns, get some money to help people establish property to do those things. Whether, you know, it's creating an avenue for people to have centers, drop-in centers like HepPAC, or housing facilities, emergency shelter for people who are actively using.
I would love to see organizations actually be able to hire people who use drugs as experts in their own field, not just through incentives, not through gift cards, but actually on staff, giving people the responsibility of a job that they would be the expert at.
Cash, like down with gift cards.
Down with the gift cards, up with the cash.
That's right.
But I'd love to see a living wage for people, and I would love to see people who use drugs, who work in organizations like ours, have better support. And that a way that we can, as a coalition, would be to like brainstorm how we can best support people who use drugs.
So like I do recognize that sometimes my drug use might interfere with my ability to do my job to the best of my ability. And then, so what do I need, you know, like, so that we don't lose me, so that I don't overdose and die, you know, like.
That example of like putting on your own oxygen mask before assisting somebody else. And so taking care of ourselves and having better resources to help with burnout and vicarious trauma. And just, I mean, honestly, if we had money to pay harm reductionists statewide. I mean, there's so many agencies and syringe programs that are working strictly at being volunteers.
If we've always been given pennies or nothing to do this great work, and so folks don't even know that it's feasibly possible to ask for these things. Like, AHF can get $100 million and they're doing all kinds of stuff, right? But harm reduction programs are just like, can I get enough money for syringes just to run my program, right? Versus like, no, I need $1 million a year to have a building, a couple vehicles, pay my staff, and have all the supplies. Like, flatline. I should not have to be fighting for pennies to just do some baseline work. Like, how long does it take us to prove that freaking harm reduction is an impactful public health strategy and actually saving lives and saving money across the board? So, yeah, that thinking big is kind of hard when folks have not been used to. It's not been a reality to think big. It's been like, why even bother thinking about this shit? It ain't gonna happen. So I was just trying to get a little bit here and there just to sustain. We've always just been trying to sustain.
Keep cheery funding going would be really great. I think that continuing to expand harm reduction services in areas that haven't had them is important. Like, I think a lot of people, it's easy to think of California as just like this utopia with like services everywhere, but it's not.
I would just love to see more funding. I mean, as of now, I know our program, along with a number of programs throughout California, you receive this much funding to provide this amount of services.
I would like to see that the advocacy that CASEP is involved in on the state level and working with, all the other coalitions that they work with and the epidemic and everyone else to make sure that the funding is stabilized so that we can then look past and have 5-year plans. Oh wow, wouldn't that be great to have a strategic plan for harm reduction?
I see our lobbying as one of the most important things that CASEP's ever done. We were a mutual aid coalition for a very, very long time and kept in touch with each other and learned things about each other and supported new programs. But I think the single most important thing that we've done is that we've said, hey, we have something that other people need. And we have something that we can teach people, and we have expertise in a way that other people don't. And I think once we started coming as a whole coalition to say that at the state capitol, that things changed.
Help legitimize us as a combined force of extremely important agencies doing extremely important work throughout California. So when it's time to talk to these politicians, it's not just an ad hoc group of people who are doing this, but like a legit force, right? Not just, oh, a finger here, but you put all these fingers together to make this powerful fist to like hit them with, bam, I need this, and bam, we need that, and bam, just like hit them with all we got.
I have so many big hopes for the CASEP Coalition. Some of that, I would hope for decriminalization of drug use and sex work, and I believe that we can do that together as a coalition.
It means that opens us up to do decriminalized programming, right? So if drugs are decriminalized, we can do consumption rooms, we can do whole decriminalized facilities, access to all types of services within these facilities. Harm reduction is one of the most effective tools we have to end homelessness. And I think through ending the war on drugs, through establishing decriminalized programming, we would make major gains towards that end.
I think that the most serious problems that we deal with, that I hope that the harm reduction movement will continue to take up, are poverty and forms of violence, state violence, police violence. Here in San Francisco, we deal with very serious violence against people who are unhoused. And yeah, like Chaos just said, definitely gender-based violence, violence against women, and the effects of a racist society. That's really what we see at the Syringe Access Program. I think that everything else is very real, and we do deal with everything else, but it's secondary. And so I hope that we'll continue to focus on those structural issues.
We needed safer consumption sites we needed decriminalization and legalization yesterday. So continuing to fight for those things to happen, I'm all for it. So.
I just had the most passionate participant come in yesterday, telling me all about safe consumption sites in Europe, and just telling me all the data, the statistics, the facts. And it was great because it was a lot of information I knew, and it was also a great opportunity for us to just talk about that and what that would be if we had that model here in California.
I would really love to see a safe consumption site in Los Angeles. So that's one of my greatest wishes.
I think doing safe consumption sites and decriminalizing drugs like they did in Oregon.
My greatest hope is for laws to pass that allow us to have a safe injection site, safe consumption site. A lot of the staff that work for the Center for Harm Reduction, including myself, we've been to Denmark. We've seen safe consumption sites operate.
California harm reduction in general, I would like to see in the next 2 years supervised consumption access. That's something that I think we really need. And as far as CASEP goes, I would really like to just see us grow and become a more substantial group that is advocating for these kinds of changes at the state level, particularly around things that might be more controversial.
A really huge part of it, we can't call for human liberation or abolition without including people who use drugs and people who engage in sex work, and people who are experiencing homelessness as well. It's incomplete without them.
Doing advocacy work as a consumer has been life-changing. I used to be so ashamed. I was so ashamed. I felt like I really had to hide one of the biggest parts of myself, and to actually be able to have the privilege of coming forward and speaking as a consumer and actually having my experiences be helpful to other people has turned everything around for me. I went from being completely silent and reclusive to wanting to take action for people like me who can't have the privilege of speaking like I do. I feel like a whole human being again. I'm not a problem to be fixed. I'm not a potential person. I'm a whole person with goals and needs, and I have the right to have those needs heard.
I feel like we've done so much already in the last 2 years. We've gotten the core budget request and started the Cheery program. We've been able to double our clearinghouse funds, and I think that just as a collective, as a group, we're going to be able to continue advocating and just really make California harm reduction solid.
Mine is that we win our fights, we win the things that are threatening our very existence, and we get off of the back foot, because it feels like the last year has been for a lot of programs in a lot of places, a lot of responding to threats and responding to things that shouldn't even be obstacles that are in our way, but they are.
I hope that everybody really comes together, because it is a groundswell and a movement, and if we all work strongly together, we can really affect some change.
I'm so stunned in 2021. The fight is part of the work. I've come to accept that. I didn't realize that going into this 2017, well, God, it's a slam dunk. But it's not a slam dunk for a lot of people. And I don't have patience or time to hold everybody's hand to get them to come up into the century that we're living in. But the fight is part of the work, and I've come to accept that. And we're in for the long haul. So we got the next fight coming and the one after that.
I'm glad to see that we're moving forward. It's still together, and in many ways getting stronger.
We just need people to be mobilized. We need people to understand what harm reduction is and just come out here and work with us. When I came into the harm reduction movement, I was really inspired by the people that were in it and the people that I met, and I want to catch that spirit and let people know that the mutual aid work that we do is worth participating in, and just jump in and let's do this. When we fight, we win.
Keep winning. because that's the theme. When we win, we fight, or when we fight, we win.